Let's talk about the Social Health Authority and Social Health Insurance Fund. I know we are aware the government introduced this the health insurance model some few months ago, and there've been so many complaints from people, one from the health service provider and from the patients or from the clients or from the community, just crying about the money that has been allocated to services, which is very little. They're saying the money is very little, they cannot offer those services. And I love the idea. I love the idea. Sincerely, I love the idea. When I look at the document, it's a good document because you realize during NHIF, there are only few people who are supposed to use that NHIF, and essentially there are only civil servants. The other people are considered as others, and you realize the percentage of the civil servants in this republic are very few. But those guys who are working in private institution, even those who are earning 1 million, and you are contributing 1,700, which was the highest contribution. If you go to a hospital, you are asked, are you from public or private? If you are from private, then you are considered as others. You will not receive the care that you need. So I think that is a good thing. It's a well thought idea. But the issue of money allocation to services, I believe I believe the people who came up with this idea looked at so many factors, so many issues, and that's why they came up with maybe, for example, 900 shillings per month per year for consultation, which is almost 75 bob per month. I believe due to calculation, and there's so many people who are siphoned into the system, considering the NHIF were only dealing with so many people are contributing, but it was only funding small people in the community, and this one is supposed to expand and deal with all people in the Republic of Kenya. Then it means the costing issues becomes difficult, and that's why maybe 75 bob was put per family per year for consultation, and very few money allocated for other services as compared maybe to NHIF. So what options does the government have? One of the options is we have the law of demand and supply. If we have to decrease or reduce the price, once you have to increase the supply. So my advice is let the government increase the supply. How is the government going to increase the supply? Make sure it builds hospitals, public hospitals across Kenya. So many hospitals, let them increase the health service provision. That is by increasing the supply. Increase the number of hospitals, equip the hospitals, make sure you employ more nurses, more doctors, more health services, more radiographers, more physiotherapists, more healthcare providers. Employ so many. Because automatically, when you increase the supply, definitely the prices will go down. I think that's one of the major things the government has. It has to increase the infrastructure. It has to increase the human resource in terms of the human resource in healthcare in healthcare institutions, and let it go down to the grassroots, so that at least and actually even as they do that, it's going to be one of the way of achieving the universal healthcare coverage, which is all about affordable and available healthcare provision to all, which is an SDG 3. I think that is the best thing. Is the best thing that the government can use to make sure that these 75 bob shillings they're talking about, consultation and X-ray radiology lab, 75 shillings per month, they're talking about per family per year, can be achieved. Thank you, and have a great day ahead.